Hey guys, Dr. Jeff here from Newman Chiropractic. Let's talk about inflammation today. So inflammation is that swelling response. So if I were to bang my knee here, it will swell up, and we're used to seeing, say, a bruising pattern or an actual swelling of that particular joint. What actually happens in that case is injured tissue is there, blood flow is directed to that injured area to help clean up that injury that took place. So what happens is these things called inflammatory mediators end up targeting this tissue. And similar to other aspects of hormones and stuff in the blood, when these inflammatory mediators touch the injured tissue, they end up sending off a signal that promotes more inflammatory mediators to come in there. There are many different types of inflammatory mediators. We've got prostaglandins and leukotrienes, and what these are is, if you're familiar with any of these, like asthma medications on the TV, I always get a kick out of them because some of them, they primarily work on prostaglandins, right? So inflammation of the lungs, asthma, most medications work on the prostaglandins. Well, there's one commercial I see on the TV that works on the leukotrienes instead. They say, we work on the leukotrienes, and that's why ours is better. Well, leukotrienes are a different type of inflammatory mediator. And each one of these inflammatory mediators can actually do different things inside the blood, but they all focus on either making your vasculature larger, making the vasculature smaller. It can increase cell growth. It can decrease cell growth. It can necrotic tissue so that old damaged tissue can get out of there and more stuff can get there to heal. But they all play major roles, and the goal is to have an adequate amount of inflammatory mediators inside the body. Typically, the average American, we have higher levels of inflammation in our body. Now, the reason that is because of all these pillars that we focus on here in the office, right? We can increase systemic inflammation by nutritional means. If we're too mentally stressed, our inflammatory mediators will be too high, all those types of things, all right? So signs of excessive inflammation can be autoimmune related, okay? So if you have autoimmune issues, you tend to have high levels of inflammation in your system. So if you are someone and you're thinking, wow, do I have high levels of inflammation inside my system? There is a test, the CRP test. They can order out for that and see your inflammatory markers and see how many they are. But some simple ones that you can do on your own is, am I injury prone? If you're injury prone, all right, typically when you are performing activity, right, your body is irritated during that activity, and then you have ample time to rest and recover, and that tissue becomes stronger. You go to the gym, you get stronger, and then you end up getting better. But if you have a lot of inflammatory mediators inside your body, what you're gonna find is that you tend to get injured a lot. A lot of repetitive stress, overuse stuff ends up taking place, okay? The second one is that you get stiff joints. You tend to be someone that complains a lot of arthritic pain, so arthritis, right? If I have arthritis, oh, my knee's bad, that's because of arthritis. Oh, I got thumb issues, that's because of arthritis. Or, oh, my back is bad, that's because of arthritis. Well, arthritis is a thinning out of the joint, but the inflammation, the excessive inflammation surrounding that joint is really the thing that causes pain. Inflammatory mediators are the things that signal this substance P, this other aspect in your blood, to actually elicit the pain response. So if you have arthritis, that heightened inflammatory response will actually elicit pain in that surrounding unhealthy tissue. But if you're someone that has arthritis, like many of our patients, they have arthritis of the knees, they have arthritis in the back, but they lower their inflammatory levels, no pain. Okay, so if you are someone that is in kind of chronic pain, you have high levels of inflammation. All right, another example of high levels of inflammation is if you always feel that you're warm. All right, if you have difficulty with temperature, all right, inflammation causes an increase in heat, right? So if you run high and you actually have a hard time in the summer and feel better in the winter because you're more comfortable, and you never can feel like you're getting comfy in hot weather, you're actually from the inside out, you're warmer. Your body temperature is warmer than it could be. So that would be another example of why, another thing that you can notice that would make you want to reduce your inflammatory levels. Now, all of these things tie into the injury recovery process, or acute injury, subacute injury, or chronic injury. Now, acute injury is the initial recovery process of this inflammatory process. So we get banged in the knee, you're looking at 7 days, okay? You're looking at about 7 days of that acute inflammatory response to really get better. I mean, it could be 2 to 3, right? And 2 to 3 days is where a lot of it takes place. But in terms of how you're feeling and your pain, you are back to, a lot of times you're back to where you were prior to the injury, and everything is kind of settled down. Okay, so you're back to where you were, and then you aggravate it again. That's another acute injury response. So the way I look at subacute and chronic is subacute is that in-between stage where an ideal patient would be getting better, okay? So you have the acute injury, then you're in the subacute stage where you're recovering properly. That's like a strain of tissue, takes about 6 to 8 weeks to recover. So you're looking at a 2 to 3 to a week time frame of the acute. Then you're looking at a subacute stage of getting better. When something becomes chronic, to me that is a recurrent acute irritation. So if you have chronic knee pain, you are doing something throughout your normal everyday activities, like a biomechanical hiccup, right? Maybe you're going up and down stairs, not too much, but improperly for your body. And if that becomes the case, then you are constantly causing these new acute inflammatory responses to target that knee area. So for the back, if you're someone that bends over in a less ideal form, we'd obviously want to improve that and eliminate that that form from taking place. But if you are bending over improperly, you are irritating and irritating and irritating and irritating that tissue, causing these inflammatory responses to target that lower back area. And that's what really causes the chronic pain to really feel like, hey, I got some chronic back pain, it's never going away, and it's bothering me for years. What you really are, what that signifies to me, and when you come in as a new patient, is that we have not, or you have not, with the right guidance, we have not helped you understand what movement pattern you are doing that's causing this inflammation to continue to cycle and spiral out of control, causing you to have a feeling of chronic pain. Okay, so I hope that's helpful. We can help a lot as a chiropractor in helping you. As you've noticed from my other videos, we help you understand. We kind of pick apart and find which little areas about your lifestyle are picking around at this inflammatory response, and we want to eliminate that, and we end up seeing good improvement with you when we do. Okay, so we really just want to help you find those things, and then you can do what you want with them. But if we help guide you, I mean, delegate that to me. All right, I'm very comfortable in helping you understand those things, and then you can do it on your own. All right, take care.